Good morning, everyone. It's Friday, the 8th of October, and welcome to the monthly forum. We're delighted that you were able to join us. We're going to go ahead and get started with our administrative report, so we'll go directly to the screens.
Okay, our COVID status update mostly is good news to report. The breakout is contained across campus. We feel like we really have a handle on this. The second point is we've had no new cases to report. There's no one across the campus in any level of care, assisted living, skilled nursing, or independent living that are either under observation or showing symptoms of COVID. And we've seen, number three, a significant drop in the positivity rate here in Pinellas County, which is down to 6.5%. So all good news to report, which means we're ready to reopen. Just as we've done in the past, we've broken this down into a sort of a phase one and a phase two. We don't want to go too fast. We want to make sure that we're deliberate in our approach. And so we're going to break it down into what we're doing this week and next week. So next week, our dining room will reopen for lunch and dinner, and small group activities will return. The following week, on the 18th, we will see group transportation return and large group activities will come back. Vaccinated employees. As everyone knows, we're rapidly approaching the 15th of October, which is the date that we've set to allow our associates to either get vaccinated or move on. What's left? As of today, we have 19 associates who have not yet made the decision whether they are going to be vaccinated or not, and we have 21 associates remaining who very likely have chosen to move forward. So as of today, here's what that picture looks like. We have 19 associates who are undecided. They just haven't made up their mind whether they're going to take the vaccine or move on. And then we have 21 associates who are working out their final days. They've already made the decision, and they are very likely not going to be staying in their positions. So that brings us to about 40 individuals who are left. What that also tells us is that more than 90% of the associates are now vaccinated. So with 97% of our residents being vaccinated and 90% of our associates being vaccinated, we are really close to herd immunity if that in fact is a thing. Next Friday, the 15th, and then on Tuesday, we'll be doing the paperwork and the health department forms that are necessary in order to receive the booster shot on Friday. Again, Leslie will have more information on that in just a moment.
Okay, so that's our COVID update. It's pretty simple and straightforward, but most of it is great news. I did want to also talk just a little bit more about our staffing situation and not only the problem of getting new recruits into Regency Oaks, but also the fact that we're going to probably lose another 15, 20, maybe a few more associates on the 15th of October when the vaccine grace period expires. As you know, Sandra and I did a fireside chat on Monday where we shared information with all of our residents on just how significant this issue is, and we alluded to the fact that it wasn't just Regency Oaks, but it was a broader spectrum. And so I found a really good video. This is from USA Today, their business department, and I wanted to share that.
Have changed. I think people that accepted low wages now want more. They want those benefits. They want to be able to take a day off if their kid is sick and stay home and still get paid. This is really one for the record books. We had several months of historically large worker shortages. And people figured when the vaccine rolled out, people were back to work, kids were back in school, it was probably going to abate. And the gap is still there. And businesses and industries across the country are really concerned about it. There's a confluence of factors that are leading to the shortage. You had about 1 million people who retired early during the pandemic because they were going to get laid off or there were issues around the job. They would have left the workforce anyway in a couple of years, so that's not the biggest issue, but that's part of it. You have a lot of lower wage workers who left or lost jobs, and they're saying that when they go back to work this time, they want something better. They want better wages, they want more protections, they want better benefits, so they're not just taking any old thing that comes along. Higher paid professionals got used to working from home, and they enjoyed that work-life balance. And so a lot of them are saying, if you want me to come back to the office full time, I'm not doing it. So they're looking around for other jobs. Childcare remains a problem. A lot of childcare centers are not fully open. Aftercare programs are not really back in swing. And people are still worried about this virus. A lot of people are saying, I don't want to interact with the public. I don't want to get back out there. The impact of this is really across the board. About 49% of small businesses said in June that they couldn't find workers to fill their positions. We're seeing this in restaurants. You're seeing warehouses and trucking companies that are having a hard time. Again, with higher paid professions, you have people that are pickier. And so it really is affecting all regions, different sized companies, small businesses and big businesses alike. A lot of economists talk about this and they really disagree, but most say no. People want a job. They want stability. They're not going to give up the chance to work for benefits that are temporary. Wages actually have gone up about 3.6% in June as compared to the previous year. And you have a lot of businesses to try and entice workers that are offering bonuses or are raising pay. So pay is definitely up, and that's something that's really an important incentive because for a lot of people, going back to work for minimal wages is just not going to cut it anymore.
All right, so now next up is Sherry. I'm going to pass the mic to Sherry for her administrative report.
Thank you, Brant, and good morning, residents of Regency Oaks. Happy Friday. My report today is on August's financial statements. Our August net operating income was $267,000 on a budget of $380,000. We were under budget by $112,000. Year to date, we're at $2.4 million on a budget of $2.7 million with a variance of $346,000. Relating to August revenues, we were under budget by $233,000. Our independent living was $28,000 under budget, ALF $13,000, and our health center $178,000 due to census and payer mix and staffing. IHS was also slightly under $14,000 for the month. Our year-to-date revenue is under budget, $233,000. However, our wages and benefits are under budget, $149,000. Our controllable expenses were over budget by $40,000. We did have an increase in our monthly marketing expenses, but that will true up for the remainder of the year. And our non-controllable expenses, which are our taxes and insurance, were under budget by $12,000. Thank you, and have a great weekend.
Good morning, Regency Oaks. Here's an update for the health center for the month of September. As we know, as Brant mentioned, the COVID positivity rate is on the decline, which is great to hear for our residents in the healthcare center as well as our staff. All staff that are not vaccinated are being tested once a week currently. The outbreak in the health center saw its last positive case on September 1st, and we have no additional cases to report for employees or our residents at this time. All staff are now wearing KN95s and face shields have been discontinued, and we continue to focus on the vaccination mandate for a deadline of October 15th. Recruitment is still a major focus for the healthcare center currently. We continue to work with HR and Brooke the recruiter for Regency Oaks to help staff our open positions. We also continue to work on the retention to keep that amazing staff that you know and love here at the health center. The health center is working with Sound Physicians as part of the EverSafe 360 program experience to roll out a telehealth program that will go live on October 25th, 2021. This service will have a physician available to the residents in less than 5 minutes at the health center. This will help the nurses be able to triage patients and help with residents going out to the hospital and keep them at home. This program will run from Monday through Thursday from 5 p.m. to 7 a.m. and on Friday through Sunday from 5 p.m. to 7 a.m. Monday morning. The ALF has continued to run on 23 on a budget of 25.5 for the month of September. Today's census is 26 on a budget of 25.5. We continue to see the ALF run full. We expect that through the rest of the year. The SNF, the nursing home, ran on a budget of 26 out of 52, and we're projecting the SNF census to be at 35 on a budget of 52 for November. Department of Health was in for an infection control survey on September 2nd. No citations or deficiencies were found during the visit, and they stated that we are continuing to be the golden standard for following infection control measures. And that is the update for September for the Healthcare Center. Thank you.
Good morning, Regency Oaks. This is Renee, and I'm reporting for administration for the month of September. I assisted with the resident satisfaction survey rollout and event. I distributed surveys to all the residents that did not attend the event. And I'm happy to say that we hired a part-time receptionist for the South Front Desk. She has gone through orientation this week, and we plan to start training her next week, and she will be taking over Sally's schedule, and then Sally will be full-time at the South Desk Monday through Friday. And that's all I have for administration. Up next is Christine with IHS.
Thank you, Renee. Good morning. It's Christine from Innovative Home Services. This last month of September, we hired a new PRN certified nursing assistant. We had 4 estate sales, and we had a great turnout. Thank you for everyone that attends. We did a mailbox stuffer, which was a great success, and it was a word search. And we are giving actually 2 free hours to the winner, which was Chet Janes. And we will also be doing this for November, December. Again, thank you for everyone who actually responded to it. We had a great turnout, and it was a lot of fun. Next up is Perry.
Good morning and happy Friday for marketing. I'm Perry. Our results in September, we had 5 closes on a budget of 4, so that was good. One of the closes came as a result of a June marketing lunch and learn that we had, and another one was a result of a guest stay just a couple of weeks ago. So our activities in marketing continue to pay off, and thanks to all of the residents for being good partners with us. Hannah has transitioned now from maintenance to sales full-time, so we're excited to finally be fully staffed. And next week we will have Bill Burrows. He'll be a new sales associate, residency counselor that'll be starting with us next week. So we're excited to have Judy's position filled and look for great things out of him in the coming weeks and months ahead. We continue with our e-blast and postcards out to various databases and mail lists. And on September 30th, we had a different event. It was called Rewire Your Retirement and Take the Tire Out of Retirement. It was really showcasing the activities and the lifestyle that we have here at Regency Oaks, and that worked well. We have a close scheduled next week as a result of that lunch. So things continue to go well for marketing. Thank you.
Hello, I'm Sandra Novotko, the Human Resources Director. In the month of September, I attended the LCS Human Resource Conference and brought a lot of information back to the community. Also, we are busy reviewing vaccines for employees to ensure our staff meets the October 16th deadline to get both vaccines. And we are also reviewing the hiring and recruitment process for potential staff reduction due to the vaccine mandate as well, which you reviewed in the video last week.
Good morning, Regency Oaks, and happy Friday. For my September accomplishments, I participated in the survey party, which was well attended, as well as I also went to the Community Life Services conference this month with all types of great input and ideas for us to be able to move forward in activities. Also, I assisted with the Employee Appreciation Chick-fil-A lunch. And I coordinated Senator Hooper's political visit, unfortunately, which did not happen, but we are working on an alternative date. Just, fair warning that we are moving forward on the campus. Brent did let everyone know that starting October 18th, we will go back to large events. We look forward to seeing you at our Halloween party on the 28th. So if you haven't thought about what you're going to wear, your ghouls and goblins, we really look forward to seeing you. Also, just to tailor out to something a little more special to me, I want to thank everybody for congratulating me on my engagement. Thank you, thank you, thank you. I really appreciate it, and we'll have the party here.
Happy Friday, Regency Oaks. Leslie Haas, Resident Services Director. In the month of September, we had 2 CVS flu and shingle shot clinic. We do have another one coming up on October 20th. That was rescheduled, and again, it'll be October 20th. We'll keep the same time slots as before. I participated in the resident survey that we had. We continued our Good Grief support group. It has been rescheduled for Mondays now from 10 to 12 in the North Sports Lounge. We continue with our monthly sharps and prescription disposal and continue to screen residents and staff members and visitors on campus, as well as maintaining the resident isolation list. For the Pfizer booster clinic, I want to remind everyone, have your forms completed by October 12th. At Tuesday, we'll be having 2 registration clinics. One will be from 10 a.m. to noon, and the other one from 2 p.m. to 4 in the town hall. No need to rush down. We'll be able to accept everyone's registration forms, and once completed, we will hand you back a letter, which will be called randomly on Friday, October 15th. The times will be from 9 a.m. to 4 p.m., where we will be able to administer the Pfizer shot booster and be able to give you new cards for your COVID-19 booster shot. If you have any questions, please give me a call at extension 501.
Good morning, Ricky Bacher, Food and Beverage Director. Our updates for September are Labor Day picnic, the survey breakfast and cocktail party, the Rosh Hashanah dinner, the pop-up dinners in the breezeway. This Sunday will be our last day for deliveries, and on Monday there will be buffet service in the north for lunch and dinner, and the south for dinner in the dining rooms. The offerings will consist of soup of the day, which will be brought out to you by a server, along with your beverages. The buffet will consist of the salad bar, 2 main courses, 4 daily sides, roasted chicken quarters, baked salmon, alternating sweet and baked potatoes, alternating zucchini and broccoli, and we will have a dessert bar. To-go orders will continue to be the same as they were when the dining rooms were open, and the tavern will be closed for breakfast, lunch, and dinner until further notice. Thanks, and have a great day.
Okay, so that concludes our forum for today. Next Tuesday is the registration day for the COVID booster. Now that's running the majority of the day, so there will not be a Tuesday talk next week, but I hope to see you in the lobby helping to fill out your registration for the booster next Friday. Have a great weekend. We'll see you Tuesday.